We will now see on a continuous glucose monitoring system. So this is a very exciting concept which every practicing diabetologist, practicing physician should know on this continuous glucose monitoring system. It is a very upcoming concept, like what was there before 7-8 years back has now changed. The way we see into diabetic patients has gone a very radical change with the availability of continuous glucose monitoring system, because earlier it was all costlier when we want to monitor this patient with CGMS. Now it has become more affordable for a normal patient to use this continuous glucose monitoring system. So we'll see over the next session on this part of the concept. So why do the patients need a continuous glucose monitoring system? So we'll just call it a CGMS henceforth. Why should the patients need continuous glucose monitoring system? The reason being, it can be to explain in a very simple slide which is shown over here. Earlier, when we were monitoring the patients, we were relying only on HbA1c. HbA1c always reflects what has happened to the patient in the past 4 months. It doesn't tell anything about what is happening to the patient today and what will happen to the patient in the next 3 months. We just retrospectively look into the patient and see, like, your control is good, your control is moderate, your control is not satisfactory. So this is what we have been reflecting by looking at the HbA1c. Does it in any way help to tell, yes, this is what you need to do at present? It was not giving us an idea. So that idea of what we need to do at this moment, on today, on day-to-day management of diabetes, happened with blood glucose, like what we discussed in the previous session. The self-monitoring of blood glucose, we can monitor the sugars, whereby we can tell them like how much amount of insulin they need, what type of control they need, everything at present. So self-monitoring of blood glucose was giving an idea. But continuous glucose monitoring will tell, like, what is going to happen in the next 2 hours, what is going to happen in the next 3 hours, whether the patient will go for hypoglycemia, whether the control henceforth will be good. So that sort of data also can be predicted. It is not exactly mimicked. It can be predicted by continuous glucose monitoring. So that is where the advantage of continuous glucose monitoring comes. So as we see in this chart, when the traditional blood glucose testing, so if you want to measure your blood sugar in your patients, so what do? We tend to measure the sugars. So the patient checks the blood sugar over here, the blood sugar over here, blood sugar over here, blood sugar he checks at a predefined time. So we see all these things all under control. But in spite of that, the patient's HbA1c might be higher, because what is happening is, what happens in between these readings, like probably we might be missing this picture. So that is where the continuous glucose monitoring comes. Like, it gives a total idea of what is happening to the patient 24/7 in the next 2 weeks, or in the next 10 days, or in the next 5 days. As long as the patient is on continuous glucose monitoring, we are able to tell very clearly what is happening in the patient, and what is going to happen in the patient can be predicted to some extent. So this is the idea of continuous glucose monitoring system. So what does a CGMS do? Continuous glucose monitoring system records sugar every 5 minutes. So it has about 288 readings per day, which is a whooping data. So in an effortless way, in a pain-free manner, we are able to pick up what is the blood sugar every 5 minutes to the patient. So it gives an idea of such a grand reading. So this can be worn for 3 days, 5 days, 7 days, 10 days, 14 days, as defined by the companies. So it gives an idea about the continuous glucose monitoring or continuous glucose recording, which happens in the patient for a predefined period of time. Find out when the patient's blood sugar are going high or low. So as these sugars are monitored on continuous basis, we can know that whether the patient's blood sugar is going to be high or low by looking at these readings. Also, we can have a look at what does the food does to the patient for that particular time. So if you take some predefined breakfast, how the blood sugar is going to be for that breakfast, we can predict that. How does exercise influence your sugars? So that is another thing we can predict. So the medications effect, like it could be your OHS, or it could be the insulin that is administered to the patient. So how does the medication influence his blood sugar on a live basis? Or is there a role of stress which is affecting the patient, or what happens to the patient during sleep? Everything can be predicted every 5 minutes. Every 5 minutes you have a blood sugar reading, whereby like we can know from that like how much is blood sugar is being influenced and how much is blood sugar control is happening. So indirectly it helps one to stabilize the blood sugar in a more effective way. This is what the continuous glucose monitoring system gives. So who needs a CGMS? That is the most important question. So the answer to this question is almost all type 1 diabetic patients who want to get their blood sugar aggressively managed, aggressively treated may need it. So the answer is all type 1. In type 2 patients, aggressive management whenever is needed, the patients need a CGMS when the data doesn't correlate. When the data doesn't correlate between the SMBG, between the HbA1c, between the patient, when he says like he has been doing everything but still the HbA1c is higher and his blood sugars are not getting corrected even with the best of the management, with the best of the monitoring possible. So when all these things are not correlating, we can put the patient on CGMS and see what is happening to the patient. Pregnancy is one area, though it is not approved in US. Outside the US, it can be monitored very well, because that is one place where we want the patient's blood sugar to be controlled in a very effective way, to see the mother in a real-time basis, or to educate them on a real-time basis. We can put them on continuous glucose monitoring and see like how the way the food affects their sugars, how the way the exercise affects their sugars, and if at all on medications, how it influences them. So pregnancy is one area where they may need it in most of the patients, but the approval for this is very limited. Please remember this, it is not that approved for pregnancy, but we do use in a given patient when we want to educate them